So thank you for being a part of it. If you're in attendance watching at home, or if you'd like to call in, you can call into this number. I'm going to give you a phone number, and then I'm going to give you a meeting number. So jot these down. The phone number to call is 415-655-0052. So I'm going to repeat that phone number. It's 415-655-0052. And then once you've called in, ask you for a meeting number. The meeting number is 203-201-310. So the meeting number you're going to need is 203-201-310. And if it asks you for an ID number, just hit the pound sign, and that should allow you to join us in a listen-only mode on your phone. If you are in the meeting now and you're muted and you'd like to be heard, if you have a question, if you look in your control panel, you should see a little section where you can raise your hand, and there's also should be a little question button in that same right next to that column. So if you click in there, I should be able to see you, and I should be able to unmute you and address you. It is going to be a little difficult for everyone to speak because of the technology. So if we could just kind of either if you're on the screen now, if you're one of the attendees that I can see visually, if you could maybe just raise your hand or wave at me, then I'll try and get to you. Hi, everybody. Otherwise, it is kind of tough if we're talking over each other. So if unlike a usual meeting where we can kind of have a flow that works easier, here we're going to have to kind of stop and listen and then start talking again. It's a little we'll get used to it in a few minutes. So we are meeting today under not so great circumstances. This is our meeting to discuss the town policies regarding COVID-19, the coronavirus. This is our meeting agenda for Monday, March 16th, 2020. And our start time was 8:30 this morning in our virtual meeting. In attendance, we have 4 out of the 5 Board of Health members. We have Jeff Stevens, who is our Director of Health. We have Ray Dick, who is our Director of Environmental Services. I think Jody, our town manager, Jody Ross, is in on the meeting as well. And we should have meeting minutes of this meeting after a few days, so that will be available. We'll be approving them at our next meeting, and they should be available to the public. All right, so we're going to start our discussion about the town policies regarding COVID-19. This is a active discussion. There's new information coming in all the time. I know that Jeff has been tracking new information over the weekend. I just want to kind of summarize the latest kind of big information to me, which is Governor Baker's ruling on his latest initial ban on different things. I wanted to kind of summarize it for everyone here in the meeting and just make sure I've got all the latest information. He has banned gatherings, including all community, civic, public, leisure, faith-based events, sporting events with spectators, concerts, conventions, and any similar event or activity that brings together 25 or more people in a single room or in a single space at the same time. This includes venues like fitness centers, private clubs, and theaters. That on-site ban will be beginning Tuesday and is scheduled to last until April 7th. Baker also banned bars and restaurants from serving food and drinks on site, but will allow them to serve food via takeout and delivery services. Again, that ban starts on Tuesday and is scheduled to last until April 7th at the moment. This order does not apply to grocery stores or pharmacies. In addition, all K through 12 public schools in Massachusetts will close on Tuesday and are suspended for the next 3 weeks through April 7th. Now, in Westford, as we know, our schools are closed as of today. I think I covered all of his major bans. I just want to state that I think this was really smart to do this now, and having it be a statewide ban is, I think, the smartest thing of all, because if each community was doing it in little pockets, it wouldn't have been as effective. And so this gives us an opportunity so that we don't have to spend so much time talking about whether we would have done such a ban. Allows us to start talking about things we can do to prepare for the other side of this ban, or what are we going to be looking at in terms of data to decide when to start going back to normal and what does normal look like. So some of the discussions I'd like to talk about are things that we can start thinking about doing now that we've actually bought ourselves a little bit of time for the other side of this ban. So if we kind of fast forward in our minds 2 or 3 weeks from now, we have no idea what this is going to look like. But if things are starting to look better, and if there's talk of starting to open things back up, it won't mean at that time that there's no coronavirus in the state or in the town. It'll just mean that the numbers are getting better. And so at that time, we're still going to want to reduce the spread of the virus. And so I'm thinking that if we can put our heads together and think of some ideas to incorporate into things like the schools that will reduce the spread, we'll be in a much better position. So the first few things that came to my mind, knowing children as I do, that hand washing is one of those things that is not, that most kids aren't good at, and most kids won't do willingly. And so we could start thinking about ways to have better hand washing in schools, so that when school does go back into session and we're still trying to keep, reduce the spread of this, it seems to me that keeping kids who are sick away from school is the biggest priority. Secondly is hand washing in the schools by the faculty, the staff, and the kids is a huge priority. And then maybe, I'm not sure of this yet, but maybe some kind of social distancing for a certain period of time in the schools would be something we'd want to do as well. So my ideas, and they're by no means the only ideas, I just want to kind of get the ball rolling. My ideas would be that we might want to start talking about some kind of policy about hand washing. My biggest fear is if we tell the kids to go to the bathroom and wash their hands, that'll just be an opportunity for them to take a few minutes off and not do anything. And so I know that in most schools, there aren't any facilities for washing hands in the classroom. Most, I know of a few in like Abbott School and so forth, but most of those hand washing facilities are in the bathrooms. So my first thought was, is there any way to get more hand washing stations, maybe temporary ones, into the schools? And Sue, I know you know a lot about this because you are a nurse in the schools.
So just to say, I know like in the middle school, in the science rooms, they all do have a lot of sinks. So I know at Stony Brook, every floor has science rooms, so that is one place, and there's like 6 sinks in each of those classrooms. So that is one thing. But I agree with the idea of you can't have 600 students filing into the bathroom between every class. It makes no sense. I think the hand sanitizers in every classroom makes sense. There also, like in the cafeteria, there already have been 4 or 5 stations that kids can wash their hands or should be washing their hands before lunch, but I know that hasn't always been the case. I think signs all over the school, again, just reminding everybody the importance. Those are all the things that you can do. And I do agree, some of the good that's going to come out of all of this is that we're going to be doing, the hand washing, which we should have been doing anyway. Hopefully, maybe in the future, we're gonna keep the number of flu cases down because people are going to be better about good hygiene.
So, I mean, Sue, you brought up a really good point, which is if we can start to get this into some kind of routine, and I don't want to reinvent the wheel, and I don't want to tell the schools what to do. I think each school probably is a little bit unique, and they should be able to come up with their own policies that work for them. So maybe one thing we could be talking about here is asking the schools to come up with a principal level or a school level policy. But one idea that I had was that maybe we could do something like 1 minute when kids enter the classroom, or 90 seconds, whatever time we think they need, to take, a disinfectant wipe, wipe their hands, wipe their desk, and wipe their phone. And if everyone's doing it for that minute, then I think the peer pressure aspect will be good, because then every kid will see that everyone's doing it, and the teacher will be there watching. And if everyone's doing it pretty much on the hour throughout the day, then at least you're getting a lot more cleaning of the surfaces, cleaning of the phones, which I do want to stress is something I think is super important. Michelle? Oh, I'm sorry. You're either self-muted or I've muted you. Let's see.
How about that?
There we go.
Better.
Do we have supplies of hand sanitizers or hand wipes in the schools, or are we in a shortage?
Yeah.
So we do have supplies, and I don't know that any school district actually would have enough for that particular type of operation, every student on the hour. So we'd have to look at what the availability of that amount of material is. And we can certainly see if that's a possibility. So we may need to adjust a policy to make sure that we can actually adhere to our own policy with regards to the amount of supplies that are available.
And Jeff, I had a question for you. I've been hearing lots of rosy news about federal funds and state funds. Any idea yet how we can actually get some of those funds into the community, or is that kind of just grants that we're not going to see for a year?
Well, I think the most important thing to know is that the town is looking to make sure that whatever funding may be available, and obviously there's none today, this minute, we're going to apply for and make sure we can get. First things first, we need to make sure that we're keeping our receipts, making sure we're following that process to get federal funds. And finance department in town will be working on that with all of us to make sure that we can do that. I don't know that there's just a cache of money we can go reach in and get at this point. So I know the town finance department is going to be working on that actively over the next several days on how we can access those funds.
Okay. And the question about portable hand washing stations, I've seen them at certain events, like you see them sometimes at like Parley Farms where they've got, animals. I'm not saying any of us are experts on those, but do you think that's the kind of thing that we could get in the next few weeks, or do you think that that's going to be either a high demand item that everyone's going to be wanting, or that it just normally takes longer than that to get them?
I know the town actually has access to one right now, but it's a regional supply unit, usually meant for larger events where we can roll it out. But we certainly can look at buying one for the town, and how many would make sense would be something we could look into. But they make them, and I don't know how readily available. It's not something that's an everyday item that normally that people would get.
Okay.
But certainly I'll look into getting one and more and see what we can do.
The other question I wanted to ask specifically, Sue, because you're a nurse in the schools and you would know this best. I know that we have a policy now where sick kids aren't supposed to go to school if you're not, if you have a temperature, if you're not feeling well, you're supposed to stay home. But I do know that sometimes isn't, enforced by parents. It's sometimes not that enforced by the school. I do believe that going forward, we should have a policy that's similar to that policy, but stricter. And my question was, do you think that when kids are filing into school that it's reasonable to have either a nurse or a faculty member kind of greeting the kids and just reinforcing that? Do you think that that would help to kind of using peer pressure to keep those kids from coming to school?
Well, I think it's more about, the parents, being in charge of that, because it's a lot of times when kids are coming to school, sometimes it's because the parents give them Motrin in the morning and send them off to school. So I think it's more, and we are very strict about the temperature right now. If it's 100.4, not 104, they have to stay home, and they have to be fever-free for 24 hours without medication. I think what's tricky at this time of year, and I saw this Friday at school or Thursday when we were at school, kids are coughing right now because of allergies, because of plenty of other things. And unfortunately, there's other kids are saying, oh my gosh, coronavirus, So I think it's all about educating everybody about, good etiquette. But hopefully this 3 weeks at home, parents are going to be doing a lot of teaching of their children around these things and taking everything seriously. So even when we do go back to school, we're still going to see coughing and sneezing and everything like that. And we have to make sure we really do know the facts about what coronavirus is.
Thank you, Sue. If we could talk a bit about social distancing, I know that to me, the part of school that's the most cloistered and compact is around cafeteria times, around lunchtime. One thought that came to mind, and I wanted to run it by you guys because you all have experience with schools, is would it make any sense to talk about, and again, this is for 2, 3, 4 weeks from now when schools may be going back into session, but we still want to reduce the spread. Does it make any sense to have a lunchtime routine? if kids, for instance, were somehow either delivered food in their classrooms or would file into the cafeteria one class at a time to get their food and then bring it back to the classroom to eat. Or maybe it's, spreading, like sitting every other seat at the cafeteria. I'm just thinking about, lunchtime seems to me to be one of the most opportune times to spread a virus. Yeah, Sue?
Yeah, so I know I've seen talks about eating in the classrooms. I don't know how practical it is about every other seat in the cafeteria, because our cafeterias are kind of at a, they're already maximum, if you know what I mean. So, but I have seen things about eating in the classroom as opposed to going into the cafeteria. And that does make sense. The tricky part is kids who are buying school lunch. But again, as you said, Zach, we have to think outside the box about how it's going to look. And we're just going to have to make some changes. And hopefully with the 3 weeks we have now, we can put some policies in place to do it differently when we go back.
Jeff?
Zach, I would like to talk to our food service in town and see what her potential options are for being able to do that. It sounds great in theory, but how practical it is, I don't know until I talk to food service. But
okay.
I think it'd be a great idea if it can be done.
Okay, great.
Hello, Zach.
Hello.
Hi, this is Elizabeth Almeida.
Hi, Elizabeth.
I wasn't sure when the appropriate time is to speak, so I'll let you continue, but I do have a question when...
Oh, go ahead. This is a good time, Elizabeth. Sure.
Okay, sure. So I wanted to ask the select board is meeting tomorrow night, specifically about this. So I was looking to your board to understand what actions you would be recommending or what you would like us to do tomorrow night. We're trying to figure out how to continue as much of the town services as possible in a way that keeps our staff and officials safe. So our staff is working on that, but I would appreciate input from your board as to what you would recommend we consider.
Great, thank you, Elizabeth. Yeah, we're going to be, I know that we're kind of limited by the technology, but I believe our board is joining yours on the meeting tomorrow, or at least some of our board members. So thank you for inviting us, and we'd be glad to work with you on that.
Okay. If there's anything that you discussed this morning that we can, our town staff can start to take action on so that we are ready, we have that ready tomorrow night for discussion, that would be great.
Great, thank you, Elizabeth. Yeah, we'll keep that in mind as we have our discussion this morning.
Zach?
Okay, thank you.
Zach?
Yep, Sue?
One thing I was thinking when we talk about other things besides the school, I know restaurants are going to be closed for people to sit in, but going forward, wouldn't it be a great idea for every restaurant, every food establishment in town to have those hand sanitizers built right on the wall? I mean, I'd love to see that going forward, and maybe we can put it into a policy eventually that every food establishment have them, so that every time a person walks into a restaurant, they are washing their hands, and every time they walk out, they're washing their hands as well.
Yeah, with signage, that's a great idea. Yeah, I really like that idea, Sue, of before and after.
Well, I know, like, even at the hospital, when I did a stint at Lowell General Hospital, and outside every patient room, there's a hand sanitizer station, and inside every patient room, with the thought that when you walk in, you wash your hands, and when you walk out, you're washing your hands. So it makes sense in restaurants.
That's great.
So Zach, I think that's a great idea. And again, we have to also think about the ability to be able to adhere to that policy, such as call it a scrub in, scrub out policy. We have to make sure people can get the supplies needed, so they can actually adhere to the policy.
Well, to Sue's point about town buildings, because Elizabeth just brought this up. So we're talking about, not only town hall, but, town library and other town buildings. What if we had a similar policy? So we've bought ourselves a little time here, right? Where, town hall is closed and other town buildings are closed. During that time, again, this is a budget question. This is a availability question. But if we could get some of those, and I don't even know what they're called, but basically a stand that has the hand sanitizer, either pump dispenser on it or wipes, like you see at like Whole Foods or whatever. If we could get those to put inside and outside the front door of these buildings, I'm sure that would go a long way to keeping, the staff inside those buildings safer and the people going inside safer. So I guess my question to you, Jeff, again, I don't want to put you on the spot because you probably don't have this information, but maybe just to put on your list of to-do list would be, can we get access to those, and how quickly?
So with town hall, there already happens to be that exact device in place.
Okay.
So people coming in can use one. A policy to ask that everybody use it when they come in, I think would be great. And I like to use simple terminology that people can always understand, like a scrub in, scrub out. So people understand what they're actually doing. We're already there as far for town hall. Other town buildings, I don't know that they have the exact same thing yet. We're going to need to find that out, and I can do that. But I think that's a great idea to move forward with a clean your hands in and clean your hands when you leave.
The other thing I'd just like to mention is signage. I think that it's super huge, like you just mentioned, to make something that's really catchy and that people it just sparks their thought process as they're walking into a building. I own a poster company, so I'm glad to print up posters for these kinds of things. We do it now in the schools anyway. So if you come up with some ideas, I have a graphic designer help work with us to come up with a catchy hands washing thing, and then we could put those up in all the appropriate locations. Yep, Sue?
Even that, I around the school, keep calm and wash your hands, that keep calm.
Yep.
So something very simple, if you know what I mean.
Yep.
Because anything with too much any sign with too many words on it, people are not going to read. So it's got to be something very simple and something that makes people stop and look at it.
And a question to signage in the bathrooms, if we are trying to increase kids washing their hands in the bathrooms, would be to just put up more signage in the bathrooms. Having them hum, happy birthday or one of those songs while they're washing their hands, I think with kids is fairly effective because it's fun to do. So maybe something like, hum happy birthday while you wash your hands or something like that would be effective. Anyway, I'm open, as you guys let this percolate and as ideas come to you, feel free to let me know about them.
Hey, Zach, as far as the workforce for the town, what do you feel would be the best option for people to?
Because again, this isn't about that it's going to disappear in a week or whatever. It's about that we're trying to push this big peak that could happen off longer. And so, yeah, I would say non-essential people in our office or in any town office should try and work virtually as much as possible. Now, I know that's impossible for the town for certain jobs, but we really do have to start thinking out of the box as much as possible about what jobs in the next few weeks could be done virtually. If they're serving the public, is it possible that the public could phone in to get what they need, or could have a PDF sent to them or whatever? So I guess I would ask that everyone in their departments be thinking about, even though it's going to be an inconvenience, is there a way to maybe come in less? Maybe they come in once a week and prepare a bunch of things for the public, send it out, and then don't have to come in. Michelle, you have an idea?
Unmute.
I'm sorry, Michelle, you're muted.
If people need to be in the office, could we have staggered hours so they're not there for the full day?
That's a great idea.
Am I on video or audio?
We can hear you, Jody, but I don't see you.
Oh.
I think that.
That's okay. You don't need to see me. Can I speak?
Sure, of course.
So we're working on all that. We have asked people to stagger their hours and times in, particularly in critical offices that we need to keep operational to continue the town's operations. So I think we have a good plan in place. I'm working with each department head on their individual department to tailor what works best for them. But I am encouraging them not to have all staff in the office together at the same time. And we're doing many disinfecting and cleaning and different rituals like that. But I do have a concern, and I did type some questions. I'm not sure if they did not go to the right person, but I think my important question for right now is we have needs for our public safety responders that are not being met. And I am hearing that you have connections, but both my police and fire chiefs could use more of the N95 masks. They also need Clorox wipes for wiping down equipment and their vehicles. They need hand sanitizer, which has been in short supply in our town. And I know Jeff has some, but he has been giving it out, you know, well, it's basically being controlled very tightly, and I get why. I'm looking at the schools since they're closed to see if they can share more with the town. But we need disposable gowns for the police and fire. So I think we've got a lot of critical needs right now. I realize at some point this is going to be over and we will move on, but I really think we need to be addressing the assistance to get our police and firefighters what the supplies they need right now to respond as this ramps up.
Thank you, Jody.
Thank you.
So yeah, let's talk about supplies right now. As she mentioned, N95 masks, Clorox wipes, hand sanitizer, disposable gowns. What is the status? Do we have any of those? And if we do, how many of those do we have? Jeff?
So we do have some masks. We've got approximately 200 masks available. And some of those we actually need to keep in reserve for an emergency dispensing site if we ever need to run one, which would be really critical for anybody that's running an EDS. Some of those we can release, but it's really limited on what we can release. I also know that the police have come up with more N95, according to the deputy chief, Mark Chambers, yesterday. We're looking into eye protection. They're looking for mainly the eye protection you can put, Sue, I can't remember the name of them, but it's got a certain type of eye protection that you can wear in a hospital setting. And we're going to try to order those through Gale. And if we can't get those, I'm going to look into safety glasses because I know their eye protection is something they're very concerned about. So whatever we order, we're going to at least get on a waiting list if we can and try to do and order stuff.
May I chime in for a minute? This is Gail.
Hey, Gail.
I just wanted to say that I have called frequently to the our medical supplier at Henry Schein, and they do not have any N95s, and they have very limited supplies, and they're only letting boards of health buy maybe 3 boxes at a time of masks and things of that sort. Of course, all of the things you just mentioned are all on high demand, so the limit of receiving any of these supplies are very limited. I will, after this call, I will call again, and certainly every 5 days I'm allotted to order some new supplies. But N95s are hard pressed to get through this medical company. So,
okay, but this is Jody again. I mean, what we're hearing is that our local board of health is supposed to be directing this emergency for us through the CDC. And I mean, we can go through 50 masks very quickly. If you think about if we start responding to, first of all, we're already using them to respond to calls because we don't know what we're responding to, but we're going to go through these supplies very quickly. So there is a critical need here, and I think we need more behind trying to get these supplies our people need. And I don't know how you all do that, but that's what we need, and we need it now.
Thank you, Jody. I hear about the need. Let me just get back to Gail and Jeff for a second. So I hear that we have one supplier. Are there other suppliers that we can go to for these?
Yes, we are to another company called McKesson to see what we can actually buy out of them. We've been using a company called Henry Schein for our general needs, which we've used for years. So we're looking at every option and resource we can find to get what we need. We've been doing that for weeks as this has been ramping up. So this isn't something new to us. Trying lies on the regular.
Just to be clear, the supplies that we're trying to get are all the ones that Jody mentioned: the hand sanitizers, I'm sure, the masks, the disposable gowns, the eye protection, the Clorox wipes. I assume we're trying to get all of those.
Of course, yeah.
Okay. Are there any other supply sources that we can go to, Michelle?
I seem to have deleted the screen somehow. I can still hear you guys, but I can't see you anymore.
Okay,
I'm
yep.
working in, all kinds of pharmaceutical settings, biotechnology companies. There are no supplies to be had. And when you go on sites like Granger, Lab Safety Supply, they say that we're probably never going to see these supplies restocked. And if we do get any, the hospitals are getting priority in ordering them. They're not going to be sold to anyone else.
Thank you for that information. So Jody, I mean, to your point, I think it would be smart if we assume the worst, that we're not going to be able to get resupplied in the way that we want to. And so in terms of going through masks, like you were mentioning that, you can go through a large number of supplies in a day. Anything our safety,
somehow I deleted the screen.
Staff,
I can't seem to get back.
Mute you there. So anything that our public safety staff can do to reduce the number of supplies they need, I know that that's asking a lot, but we should just assume the worst now and not assume that we're going to get resupplied with what we need, in the next couple of weeks. Because I've heard the same thing from a lot of other professionals, that the supplies aren't there. Every community is looking for them, and every community is demanding them. So this idea that somehow the Board of Health is going to have some special way to get them, it doesn't sound like that's going to happen.
I'd like to point out that we actually had quite a few supplies on hand, and we've done very well. But supplies do deplete, and we're going to keep looking to see what's under every rock we can find. So we know there's a need, and we're going to continue to do that.
Right, and I just want to stress that this is a multi-week scenario, so it's not like we can just feel like, oh, well, as long as we've got the next few days covered, it's going to last a long time. So we have to make sure that we're rationing those supplies. But if under that idea, though, if you could be just giving us an update, every week or so as to how things are going with the supplies, that would be helpful, just so we can get an idea if they're getting any harder or easier for you guys to obtain. That would be great information for us to have. I think one of the problems that I'm having right now is getting good information. So, I mean, I think we all know about the Johns Hopkins website, where you can see an updated map of what's going on across the country and across the world. The problem I have with that map is that it's just data is only as good as the data that you have. And if you click on Massachusetts, for instance, you get a red dot that shows you the number of suspected, as well as official. It doesn't appear that there are that many people who have actually been tested for coronavirus in the state. And I believe I'm hearing this from other states and countries as well. So the problem is we're not getting accurate information about what's going on, and we're kind of flying blind to some of this data as of yet. Now, maybe that'll get better. Maybe there'll be more testing kits available. But from what I'm hearing, a lot of patients who think they might have the symptoms are not getting tested, either because we don't have the kits or because, well, I don't know why. Sue, do you have a thought on that?
So I totally agree. I think the numbers are underestimated because people are not getting tested. And a lot of times they're even saying, I'm on a big nursing Facebook with all kinds of nurses, and they're saying some of the recommendations are not to get tested, to just stay at home and manage the symptoms. But if that is done that way, we're not going to know accuracy. So, there's been arguments going back and forth, and I personally believe we should be testing people who have symptoms, so we know. The problem is, what are the testing kits that are available, et cetera? And that is one question I do have for Jeff. At some point in time, what is the plan for what Westford would do in terms of testing, or would we have the capability? I know, for example, you have all your school nurses not working right now, so you would have school nurses available to do some of the testing. So what is the plan for how we're going to do this? Is there something in place right now or being talked about on how in the town we could test?
So the Department of Public Health will run the protocol on testing moving forward. That's not something that local public health would ever be equipped to do. It's never been on any radar that I'm aware of in my 20 years of public health on local public health doing that type of testing. The only thing that's ever happened in the past is public health nurses did do TB testing some time ago, but that doesn't happen at the local level, as you know, anymore either. I think moving forward, that is going to be a question the state is going to have to answer, and how they want to handle pandemic level events on what they want local public health to do. But there isn't one public health department locally that is prepared to do testing, with the exception of maybe Boston.
Stephanie?
Jeff, I think we had that call-in meeting with the Mass DPH last week. They're having that again, I believe, this week.
They're going to have a call-in meeting every Tuesday. I believe it's going to be at 3 o'clock.
So that might be a question to raise with them, just to make sure that's something that's on the radar.
I send that in for a question for sure.
Okay, and then just another thought. You know, we've heard a lot, and this is back sort of to the topic of supplies, a lot from people in various places about hoarding of materials and stuff. And, you know, just a thought, if people happen to have an overabundance of Clorox hand sanitizers, maybe they can drop them off outside the police station. Is there some way they can contribute to our first responders if they have a plethora of such supplies?
That's a
great idea.
Yeah, Jeff, just off the top of your head, what would be the best place for people to bring those supplies if they did have them?
Well, I would have to just make sure that I clear this with police and fire, but either the fire department or police station may be a good spot to drop off those supplies, and I think that's a great idea. I'll work on that immediately when we get off the phone.
Maybe they
This is Jody. This is Jody.
Hi, Jody.
Hello?
Yep.
Sorry. I can answer that question since I'm on this call too. I would not have them enter the buildings, but I think they could phone ahead on the business numbers of police or fire and leave them outside of the entrance to those buildings. And
Okay,
I will let both chiefs know. But I agree. I think a lot of people have stocked up on things like hand sanitizer and wipes well beyond what they'll ever need. And it would be wonderful if they could donate some of this back to the public safety responders who are finding themselves in a shortage situation.
Great. So yeah, if you just heard Jody, phone ahead to either police or fire before you are going to drop something off, and coordinate with them. And then when you do leave it outside the building. Don't bring it inside the building. That would be super helpful if the public's watching now. If you do have some extra supplies that you don't think you'll be needing, they can definitely be used by our public safety and in the schools. So that would be much appreciated. And then I hear you, Jeff, you're going to be coordinating with them about that. And Stephanie?
Since not everybody's watching, it was suggested to me perhaps we could even do a reverse 911 with that information or something.
That's a great idea.
Great idea.
Yeah, Jeff, let me ask you about that. Is that something that's doable by your department, to do a reverse 911 to ask the community for supplies?
Well, I'll talk to Jody about, and Jody, if you're on the call, let me know how we can do that. We typically have to go through police to do that. It's about putting a message. Jody, if you think that's efficient use of the technology, I'm more than happy to put a message together.
Okay, so actually those messages do get cleared by my office. Am I on?
Yep, you're on.
Or am I on? Okay, sorry. Those messages do get cleared by my office. I'd like to talk to the police and fire chief first and see if they'd like to do such a message. And if so, then we'll get it out.
Okay, and in the meantime, oh, go ahead, Jody.
Another thing you might want to mention is that the state has activated 211, which is just for information related to this virus situation, that any of the public can call in. I believe there are people answering those phones to answer their questions.
Thank you. That's a good point. And also I want to point out that the Westford Board of Health website has great links to updated information as well. So if the public needs information about coronavirus, you can go to the state activated 211 phone system, but you can also go to the Westford Board of Health website. Sue?
I'd like to add on the website information about if you do get it. You know, people, I saw something posted which was excellent about people are stocking up on toilet paper, et cetera. But what people really should be making sure they have on hand, and I'm not talking stockpile, but on hand, things like thermometers and Tylenol and Advil and cough medicine, and make sure they're, if they have asthma, that they have an inhaler that's up to, you know, that's up to date. So I'd like to put some information, and Jeff, I'd be happy to work with you on that, and Gail, about posting information on the Westford, you know, Health Department website about what to do in the event that you get sick. Because I think there's been all this talk about avoiding getting sick, which is wonderful, but our reality is people will get sick, and they do need information on what to do when they get sick.
Thank you, Sue. That's a good point.
We do have that current list, and I'll just make sure it's put more front and center on the website.
Great.
May I chime in again?
Yes.
This is Gail again. Sorry. I want to just backtrack on what Sue had said previously in regards to testing. I think this is going back to the PPE problem. I am the only public health nurse here in town. I work very closely with epidemiologists at the state. On almost a daily basis, I'm on the phone with them. Being the only one in the town that has access to Maven, which is the database I share with the state. And I'm only saying this because it's just me. And I'm a part-time employee here that I feel that doing the testing would require not just the school nurses, but the MRC nurses
Right.
That are, you know, available, which is wonderful, except none of us are prepared with our own personal protective equipment, and none of us would be able to be on the front lines being able to make sure we can do the testing. If we're going near a person who's considered a close contact or an actual sick, ill person, none of us are prepared for that out in this, you know, I don't know where we would set up a makeshift tent, and we could do that, but we would also need supplies equally. So I think not only our first responders need it, but also us nurses out on the forefront would also require this. So there's a lot of logistics, and I think the hospitals are in need, and they're hoarding their N95s because they're locking them up now. So supplies are very limited throughout. It's someone, you know, and it's becoming very difficult to get them because we're restricted at the Board of Health from getting it because the hospitals need to meet their quota. And we're not, even if things are on back order, it's not like I can say, can you just reserve this for me? There's none of that. So I just want you to know it's just a little bit more crucial. So.
Thank you, Gail.
Thank you.
Yeah, and I would like to just stress to everybody that may be watching that, you know, our Board of Health staff is a limited staff, and they've been working pretty much around the clock since this information broke. And as you just heard, you know, Gail, who is our public health nurse, is a part-time position. So we don't, it's not like we have, you know, this unlimited staff to go to. We were really thankful for all the work and the effort that you put in so far, and that you're going to continue to be doing over the days and weeks ahead.
So Zach, what do you think maybe our message we should be sending to the town is at this point moving forward? Do we want to have a potential weekly meeting with the Board of Health and set maybe time until we can kind of get in front of this?
Yeah, no, I definitely think that communication is key. So at least a weekly meeting, I think, is important. I'm really glad that the Board of Selectmen is including us on their meeting tomorrow, because I think that's very important for all of the boards to be in you know, discussing this and communicating about it. Going forward, I think it's important that we have the correct message from both the Board of Health and the Board of Selectmen to the town, so that it's a united message about what we'd like residents to do. And I do think that messaging about social distancing, about taking precautions, you know, such as hand washing and so forth, should be a united message. So I think that what we should be working on, maybe you can help Jeff at the staff level, between Board of Selectmen and ourselves, is if we can start implementing some of the recommendations about hand washing, about social distancing, at least for this first week, before we can start to lay out some of the further ones that we're going to be working on, like hand washing in the schools and social distancing in the schools once they come back. Right now, because the schools are closed, we should be focusing on things like we've been talking about at town buildings when you're coming in and going, scrub in, scrub out. I think those are great things we can be doing over the next few days. But I do want to go back to the question of whether or not we can actually get a hold of the equipment that we need. So for instance, scrub in, scrub out at these buildings, that's great, but it only works if there's the, disinfectants and the hand sanitizers available. So is that the kind of thing where we could kind of makeshift do that with some of the supplies that we might be able to get from just on our own? Even if we don't have an official hand washing station going in and out, or do we have enough supplies on hand now?
Right now, we've got a reasonable amount of supplies for employees in the building for town hall. I know the schools have their supplies of things, and where they're now closed till April, they've got several caches of supplies as well. So I think the important thing that we're going to need to do as a town is make sure we're using what we have properly, like you said, rationing and using it to the best of its ability as much as we can. And I'll work with our facilities director and the schools and Jody and make sure that we're doing the best we can to get everybody that's a first responder the best we can do on supplies, while still maintaining what we would need in the health department, because as big of a pandemic as this is, we still need to think about other aspects of public health. This isn't the only thing that we have to address. We still have to think about our restaurants that are going to be serving people even remotely, and making sure those kitchens are still clean, functioning, and running the way they should, and protecting for all the other foodborne illnesses we need to pay attention to. Obviously, our septic systems in town we have to be watching. So we're still going to have to work really hard to make sure everybody that's doing all the public health functions that we do can still do them.
So 2 points there, Jeff. So one would be, I'm not sure how you track your supplies. I'm sure they're in a spreadsheet somewhere. I'm not sure how public safety is tracking their supplies. It probably makes sense at some level for you to be talking to the heads of public safety, police, fire, and so forth, to just be kind of cross-checking your spreadsheets about what you've got supplies of. It doesn't sound to me like anyone's got this big, supply somewhere that is going to miraculously come to the rescue. It sounds more like we're going to have this problem of really strict rationing of supplies. And so I think it would help you and the other departments if they kind of knew what each other had, so that they could then ration appropriately. I don't want any one department thinking like, oh, well, we'll just use ours up and then we'll go ask this other department for more. Because it sounds to me from what I'm hearing, nobody has what they need. So it might just be valuable to contact those other heads and just share with them, at least at a high level, of what you've got, find out what they've got, so that you can at least know that, that's not going to happen. We've got to start rationing on those materials. The second thing is, you mentioned restaurants. I just want to point out to the town, the Board of Health is in charge of inspecting restaurants, and that's going to become important over the days and weeks to come, right? Because as of Tuesday, you won't be going to a restaurant to eat. You will be probably going to get takeout. And I know a lot of people in town are asking, is this safe to get takeout from a restaurant? I want to assure everybody that the same rules that were in place before this about workers going to restaurants and being not sick is super important, and we want to enforce that. That is something that the Board of Health does. Can you speak to that at all, about the fact that we've got Arnie Price, who is our food inspector, but we've got many different restaurants in town that have to be inspected. Should we be shifting our focus on these inspections to maybe a different regime, so that basically maybe Arnie is looking more for one thing over another in this next few week period, making sure that basically any workers who are sick are not coming to work?
So what we have actually been working on is exactly that. The restaurant inspection system has already been set up to make sure that they've got emergency kits in place already. They've had them, And it's to make sure that if there's a sick person or somebody gets sick at work, you've got an emergency kit in place. What we're going to do is make sure that that is reinforced and make sure that the restaurant owners are paying very close attention to that, because they need to remember that as much as they're going to take a hit by not being open with their regular business, well, if their entire staff gets sick, they're closing.
Right.
They're not going to be open at all.
Right.
So it's important that they know that. It's important that we let them know that, and we're already actively doing that.
Now, the other thing is during this time, I think a lot of people are going to start to behave differently about food, right? Because instead of going to work and eating at work, which might be out of town, there's going to be a lot of families at home, and they're going to be doing a lot of takeout. And so actually a lot of these businesses in town probably will still get a lot of business, but it'll be different business. It'll be, food deliveries, it'll be DoorDash and so forth. Is there anything we should be thinking about in terms of DoorDash and food delivery that should be treated any differently than we've been doing now? Should we be putting out some kind of, as part of our recommendation policy that we're talking about now, should DoorDash be a leave it at the door policy instead of, making contact with the person at home? Should, we be thinking of along any of those lines?
Well, I think all of those things need to come into play as far as how DoorDash and Postmates and some of those other companies run. We need to, sorry about that, phone ringing, look at how they currently handle business. Those delivery companies are not regulated right now at all. And it's been actually a frustration of public health altogether, because we regulate the restaurants so highly to make sure that they're sending out a safe product, and then we're handing it to a person to deliver to you that we don't know anything about. So it's actually kind of been a thorn in public health side anyway. I think we need to do some research on whether we can legally have them do that. And I'm more than happy to do that research on.
Well, I guess my question is, and this is again going to some of the staff, Sue, you have a wealth of knowledge. Is it better for a family, for instance, to go to the restaurant and pick up the food themselves? Or do you think that, having this intermediary, DoorDash person has any real effect on it if they're just picking up a plastic bag and leaving it at the door?
I think it makes more sense to go to the restaurant and pick it up, to tell you the truth. And I do hope that we keep, we help the businesses in the restaurants, because the small businesses, the smaller restaurants, they're really going to be hurting through this period of time. And I just hope people will. I read something about, go out today and buy gift certificates for these restaurants and help them out, because they're going to be hard hit. They really are. To have to be closed down for 3 weeks is going to be very painful for a lot of people. So I do hope people do, utilize the takeout menus. But for me personally, if I was going to do it, I would go pick it up. I trust my own hands versus somebody I have no idea about coming to my door with a delivery. Okay.
So yeah, I'm wondering if that should be put into some kind of recommendation policy, or if you think that that's just best practices by each individual family.
I think we can give advice. We can't tell people really what to do. And there are people, when you think about it, who won't be able to go out, for example, who will need to have delivery. One of the other nurses, I thought this was really nice. She went around to her neighbors. She went to all the doors of the elderly and just offered to go to the store and pick up items for them. That's another nice thing that we could all be doing in our neighborhoods, is, finding out the elderly in the neighborhood, who I'm sure obviously are more at risk, seeing what they need help with is something we all can be doing.
And the checking on neighbors, I guess we should point out, should probably be done via phone if possible, or via Facebook, rather than in person if possible. I agree that some people, may not have the ability to do that, but yeah, it does seem like in this time it'd be best to do a phone call rather than check on them personally. But that's great. That should be part of our recommendation as well, is to check on your neighbor, check on your friends and family.
Can I ask to Jeff and Gail? I think it is really important to keep reiterating recommendations for if you do feel sick. Like, I think this would be a good place right now to talk about if people are worried they may have it, what are you recommending to them?
So on the town website, in the alert banner, and Mike Wells, if you're still listening, this might be a great spot if we can pull it up.
Put me on the spot there. Yes, I am listening. Hold on.
Mike, is there a way on this webinar that you can pull up the guidance document that we developed that's on the alert banner on what to do if you are sick?
Yeah, hold on just a second. Let's pull this up so you can see. We can see it here.
Jeff, not everybody has access to the internet, though, remember?
Right. So if you, so I've got the web. You got the web page up now, right?
Yeah.
Can you see it? You see that?
Yes, we can see it.
So what was your question? Sorry.
So can you pull up in the emergency alert banner? We've got a document that's up that what to do if you are sick. What we've got there is basically what to do if you are sick, what to do, how to address yourself if you're experiencing symptoms. What I'd like to do is I'm just going to read through it, and I'm going to turn away so I can actually read my own screen.
Sure.
If you're feeling sick, some of the things people need to do are contact your doctor if you think you've been exposed or been around a COVID-19 case. You need to watch for symptoms. Contact your healthcare provider if you experience any of the following. They may appear within 2 to 14 days. Fever, cough, shortness of breath. Contact your healthcare provider prior to your arrival and at your medical facility. If you do develop warning signs such as difficulty breathing, shortness of breath, chest pain, bluish lips, or your face, immediately get medical attention. Stay at home if you are sick, except to get medical care. Practice social distancing, keep 6 feet away from others to reduce the risk of infection, and practice frequent hand washing. If there are other questions, contact the health department if your doctor directs. I'd also like to point out that within the past couple of days, home health care has put a fever number of I think it was 100.3 is what I read as a threshold. So if you were above 100.3, contact your doctor, because that is now considered a fever symptom. Sue, do I have that correct?
For me in the school, it's 100.4, but if that's what you read, that's, yeah. I mean, I think any fever, I thought I read somewhere 99.6. You know, I think they're trying to be very, any fever is what we have to be paying attention to. What I worry sometimes though, is that not everybody does have access to internet, etc. Are you posting that like outside of town hall, for example? Like, are there signs up with this recommendation in different places for other people who might not have the internet to have access to?
So we have it, obviously, most of our engagement is through social media and the internet. But I can make this available that anybody can pick up in town hall in the foyer.
Yeah, and even like at the Cameron Senior Center, make sure there's a bunch of this information. I do think as many people as possible to get the same information of what is being encouraged to do, or best practice would be helpful, I think. So yeah, Senior Center I think would be a good place to put some of this information as well.
So I did have a letter developed for the seniors and seniors only. The Cameron Senior Center also got a letter designed specifically for seniors because they are our most high-risk population.
That's great.
And they do have something that we got out there, and Jennifer Claro at our senior center did get it out to them. So we're paying very close attention to them as well.
That's excellent. Great. Thank you.
Stephanie, you had a question?
Yeah, a couple of things. One, I think it's important to emphasize that people should call their doctors before they go in. Like, this is not, don't just go into the doctor. You really need to make contact with them so they can advise you about how they want you to come in and or where they want you to come into their offices, because they've set up things for that. And then second, a question about, I've had some people commenting and asking here and from distant locations, but the same sort of questions. What if you think, or what if you've been traveling? You know, what are the quarantine recommendations? How does that, like, if you were the one who was traveling, what is that supposed to do for family members? I think we have good resources on that up on the website. But I think, you know, maybe reviewing that for those who are returning from travel and what that means is, or at least providing the guidance and where to find it would be helpful.
So I can tell you that on our COVID-19 website, I have the most up-to-date travel guidance for people that have traveled. And it's pretty clear on that particular document on what you're supposed to do. However, like anything else, if you have a variant of a situation, give us a call the health department, and that number is 978-692-5509. We'll do the best we can to get to your call, and we'll let you know if there's something different other than the guidance on what you're seeing. What we do is we contact the state epidemiologist and just verify that what we're telling you is what you should do. Guidance is pretty clear, and those documents are readily available.
Zach, one more thing, or Jeff, about supplies. I would definitely contact Bill Olson as well, because I know that every school, like, we all do have equipment. In fact, Gail, I think each of us have a whole, you know, a whole package of gowns, you know, like something that if something happened at school, we would have the full protection. So, you know, with all the schools that we have, there's 10 schools or 9 schools. What is it? 8 schools?
Yeah, 9 schools.
9. I think every nurse's clinic has some of these supplies that during the time that school is closed, we should be going to get them, you know, going through each of the nurses' clinics and seeing what they have that could be shared, because we could restock in the 3 weeks, please God. But if not, at least we have supplies for right now that are not being utilized at all.
That's a really good point.
Can I chime in again? It's Gail again. Yes, actually, I was in contact with Joan Mitchell in regards to supplies, and she and I were gonna, well, I was gonna actually just make up all little PPE kits and give them out to all of the school nurses just in case, because you guys are on the front lines with your students that come down.
Yeah,
all right. Well,
yeah.
we could certainly just look, like you just said, look for inventory. And if you're missing something, and we'll just look to see what you guys have.
Yeah.
Yeah, I mean, just, you know, sharing a Google Doc or something of what the 9 schools have, so that you, Jeff, or, you know, you, Gail, could see what they've got, so that you can quickly, you know, because to try and do all this, you know, yourself with a bunch of phone calls seems like a long time. But if you just ask each school to just put together that list and share it with you, so that you could quickly see, oh, this school needs something, or we've got more than we need over here, that's a great idea, Sue and Gail. Thank you.
So Zach, and this is for the whole board, for tomorrow's meeting with Board of Selectmen, what do you want our guidance moving forward? To follow state guidance, or do we want to be more restrictive in other areas?
I mean, to me personally, I think the state guidance was wonderful to see. It laid out a lot of things I wanted to see. So I think for right now, that's great guidance. I just would like to start seeing going forward. So maybe kind of 2 documents here. One is for this week, but then another policy that we should be working on is going forward from this week, with some of the things that we've been talking about here, about that we would like to have some kind of, I think there should be, hearing this more and more, just settling in my brain here about the supplies. It sounds like everyone's gonna, as the weeks go on, are gonna be wondering about supplies. You know, where can I get gloves? Where can I get masks? If we, as the Board of Health, had that document, that database, so maybe, Jeff, if you could be asking the schools and public safety to be sharing with you, either, I think, on some kind of Google Doc, so that you have kind of an up-to-date list of what's going on around town. I think that would be very helpful, because what if, for instance, a bunch of people come forward with a bunch of great supplies that they drop off at the firehouse? You're not going to know about it for days, right? But if they're updating that spreadsheet so that you can see, oh, okay, we just got a big supply of hand sanitizer, you'll know where to direct that. And that way other organizations in town when they're wondering like where to, you know, I need this, where can I go? They can come to you and you'll know the answer. So that's, I don't know how you want to call that in terms of a policy, but I think that having you as the head of collecting that information around town about supplies would be super helpful for everyone in town.
Sure.
And again, I don't think that should be more work on your part other than getting out the information of, you know, here's the link to the Google Doc, please keep it updated. It's going to help you when you need supplies, you know, because I'll know where they're at and what we can share. Because I think the problem is if you don't know what you can share and what we have in town, we may end up after, you know, 6 weeks of this problem having turned out that we had enough supplies somewhere that we just didn't know about. And so it would be good so that you can start to plan the rationing if you know what's going on. So I think information is key. And so yes, if you could be kind of the head disseminator of that information and collector of that information, I think that would be key.
Sure.
I think also going ahead with some of the ideas that we're talking about, the scrub in, scrub out policy and developing that to find out, you know, first come up with the policy, but then second, helping out the different town buildings, the different school buildings, the different restaurants in town with getting the supplies they need to make that policy work. Because obviously saying scrub in, scrub out is great, but then making sure that we've got everything in place that we need. So that's the next one I think that we should be working on. Then the down the road policy that, you know, when schools and things start to reopen coming up, I think that's kind of last on this list because we have a little bit of time, but coming up with a policy of what we can put in place in the schools to be minimizing the spread once school is back in session or once town buildings are open again. I think that would be kind of my third thing. What am I missing there, Stephanie?
I don't think anything missing. I just, in terms of what we can do, I think, Jeff, you seem to have been doing a terrific job communicating with the other departments. I think if we look at what, I agree that, you know, the state has done a nice job for us right now and kind of laying out guidelines. And the other thing they've done a good job with, I think, is set an example for how the Department of Public Health and the state government are working together. And so I think that communication between us and the select board is important so that they're not, you know, so that our reaction is appropriate to the situation, so that we're on target with what the most current and informed guidelines are for how to manage this going forward. So I would really encourage us to find a way to have the boards working together through this.
Thank you, Stephanie.
Yeah. I just have a question, Jeff. I know we talked at our last board meeting that you can't really say, it's a confidentiality piece about who's infected and all that, but are we going to know when we have positive cases in town? How is that going to look? Because that is going to be a question people will have about how do we then know, you know? So what is, I'm sure that will come up. When we do have positive cases, how is it going to be communicated?
All right. So the biggest piece that we have in place right now is we are now able to share with our first responders anytime that there is a positive case where that is.
Okay.
So first and foremost, our first responders are going to know if they are walking into a positive COVID case prior to getting there so they can properly prepare.
Okay.
As far as the general public goes, that information is HIPAA protected. However, whatever we can legally share, we certainly will do. We want to make sure that we're not putting people into a panic or maybe even put somebody in harm's way by letting people know that they're a positive case. So the people that need to know will be able to know.
Well, and I hate to say it, but we definitely have the Facebook frenzy where it leaks out and then everybody knows. So I'm just trying to figure out how best we can, as a group, as a board, be able to share honest information without that kind of frenzy.
So that guidance will come out of the state,
Okay.
and it has to date on what you can share.
Okay.
The state has shared most everything at the county level and not necessarily at the local level on how many cases are in a particular town. So we would know there are X amount of cases in Middlesex County.
Gotcha. Okay.
But the most important piece for us is being able to share with our first responders to keep them the safest. We can let them know that
Yep.
they may be walking into a type of case like that.
Okay, great.
It's also really important to know that the numbers, as serious as this is, and all the measures that are being put in place by the federal and state government are still in town very low. And we're monitoring day by day on what comes into town. And we're watching it every day, and whatever we can share, we will.
Okay, I have one more question, sorry. Actually, two more questions. So stores, are they, I know grocery stores and pharmacies, what about other stores? And if so, are we gonna have like, you gotta check in and check out so that there's not more than 25 people, or like even the grocery store, how is that gonna look? So I'm just, again, I'm kind of playing as the devil's advocate here, because these will be questions people will ask. So I'm just curious about it. And then my other question is about the gyms in town. Again, I know it's 25 people or less, but so are all the gyms closing, or how is that going to look?
I know anecdotally that some of the gyms have already closed voluntarily for the next couple of weeks. I don't know that all of them have, but so some have already voluntarily closed. I just want to kind of chime in on your great question about limiting the number of people in, say, a grocery store or a pharmacy. I've been giving this a lot of thought, and my feeling is that if we instituted some kind of recommendation to them that they limit it, the problem is you're going to have a line out front sometimes.
I know.
And when you have the line out front, you're going to not only have a problem with social distancing, but then you're going to have the psychological effect of like, wait, people driving by, seeing lines and thinking.
I know. Yeah.
So I feel like if we either, maybe stores to put up good signage which says, social distancing within the store, so when you're greeting other fellow customers, it's just a wave, not a handshake, and so forth. And maybe it's something like I the only times I can think of in a grocery store that we're running into a problem with would be maybe is checkout lines, right? So maybe there's something they can do in that regard to minimize that. Maybe they can keep they can institute some kind of line system. That's the only thing I can think of. But or just ask customers, remain 6 feet apart in line. But other than that, I think it's probably better in a line. But that's just my thought.
What about other stores though? Like, I'm not talking grocery and pharmacy. What's going to happen with all of our other stores that we have?
That's a great question. I mean, if you think about the other stores in town, I can't think off the top of my head about any stores that I think are going to be congested. I mean, obviously
not going to close them is my question. We're going to keep everything open as is. That's my question.
This is Jody.
Hi, Jody.
I don't think that's been a directive yet from the governor, but I do have weekly conference calls with the governor's office now, and maybe they're going to be more than once a week. We could certainly ask those questions.
Yeah.
What I would suggest is if any of you have questions, you could email them to me, and I'm happy to ask. But I would agree with Zach. I have been looking in parking lots, and Marshall's was one that used to be full all the time, and it generally is not. So I'm not sure that this is going to be a problem for the stores that are not grocery. But I'm happy to ask any of these questions and report back and put it on the website too.
Okay, good idea. Thank you.
I also think it's great for residents to know that I'm hoping the stores will stay open, because as these weeks go on and you may need things, and being able to send out a family member to get what you need in a local stores can be very comforting. So I think that if there's no, I don't see there's going to be any reason to worry about public distancing within stores other than grocery stores. And I think that luckily we have just 2 major grocery stores in town, so we could talk to their managers, maybe working with them to come up with a policy to maintain social distancing. I will say in restaurants, in stores like Whole Foods, let's say, where there's a public table system in the front where people can have their meals. I was wondering, Jeff, if you had any thoughts about asking them to come up with a voluntary policy of like wiping down the tables after each customer had been there. I mean, I'm sure they keep them clean on a regular basis anyway,
Well,
but
they really shouldn't be allowed to eat, Zach. If we're not allowing people to eat in restaurants, I would say they shouldn't be allowed to eat in Whole Foods anymore.
well, that's kind of my question is, okay, so I mean, it's not a restaurant per se, right? So, but I guess under the definition, maybe it is. I want some clarification. So basically that will be shut down because there's a couple things in town. So there's the ballroom at McDonald's, for instance, which if it hasn't already been shut down, I think we should request that they shut down. And then I think, right, things like that little eating area at Whole Foods as of Tuesday, I think.
Deli too, that Apple place. What's it called? It's Dunkin' Donuts and the bank and a farm.
Yeah, Big Apple.
Big Apple, yeah.
Okay.
That's an eat-in place too. I mean, I would assume any eat-in place would meet the definition of you can't eat in anymore. You can take out, I would assume, right?
No, you're probably right. I think you're right.
Any of those places that have an eat-in option they're not going to be able to do that. That's going to meet the definition of a restaurant.
Yeah.
And that's an area that we're going to have to make sure that's getting enforced.
Yeah, if we could have Arnie, our food inspector, just kind of double check with them, make sure they're on board and that they understand, that would be great.
Yeah, we'll make sure of that for sure. But they meet the definition, and the restaurants should be not allowing people to eat at those spots. What I'll ask them to do is pull the chairs out.
Yeah.
Okay, that's great. Because as you mentioned it, I'm thinking, if someone from outside of the state, for instance, stopped at the Whole Foods for a bite, they might not even know what's going on, and they might eat there. So that's a great idea. Is there anything that we haven't discussed that we should be discussing? Anything we should discuss further? I'm sensitive to everyone's time that they've got to get on with things today and get, especially you, Jeff. Stephanie, you have a question?
Well, not so much a question, just wanting to maybe sort of remind people that the state has said this is becoming community spread. So we shouldn't be like treating people unkindly should they come down with the disease. For most of us, this is not a serious illness. For most people, if you get it, it is not going to be a life-threatening illness. We want to protect those for whom it could be. We want to help the hospitals be able to keep up with that's the goal here, is to try and allow the hospitals to be able to keep up with the sick cases that will come in. But that, in terms of the panic and stuff, for most people, this is not a life-threatening illness. And so, hopefully we can remind ourselves of that, this is a community effort to help in a short-term spike, hopefully, to flatten that out. But that for most of us, this is something that we can weather.
The other thing I just want to thank you, Stephanie, for that. The other thing I just wanted to point out, I've heard from my teenage daughter and teenage friends that a lot of teenagers haven't, at least until this point, been taking it that seriously. I think that is changing quickly. But so just a word for parents out there watching, that if you've got kids who can come and go from the house, that, talk to them about it. Make sure that they understand that this is serious, and that, if they do head up to the mall, let's say in New Hampshire, that they should maybe not head up to the mall or take precautions when they are there. And that social distancing with friends, although it's really hard, as all of us know, especially with teenagers, that they should be implementing that. And so that's just something, I think it's important for families to have the discussion right now and not wait 2 weeks. The other thing is just to keep in mind about our own health at home. So make sure that we're getting enough sleep. I know that it's really hard when things are stressful like this to get sleep, but to remember at night to put the phone away, to read a book or something and get yourself to sleep, because your own immune system is going to work a whole lot better if you are well rested. Make sure you're taking care of yourself, and also take advantage of what we have. We have great weather coming up. So the ability to walk around your neighborhood and your house, as long as you're socially distancing yourself, is wonderful, because being out in nature is a wonderful thing. So, don't feel that you have to be stuck in the house all times. Get out there, get some fresh air. And, just try and remember that, all the basics: stay hydrated, reduce your stress as much as possible, and, keep eating well.
All great advice, exactly.
So one more question. Are we all gonna, is it just the two of you that are gonna be on the call with the Board of Selectmen tomorrow, or all of us?
The last I heard, and Jody, please correct me, is that because of the possible limiting of the virtual meeting space, that it might just be me and Jeff. I would love it if the entire board could be, so I'm just putting this call out to Mike and to Jody, if it's possible for the entire Board of Health to be in on that, because they have a wealth of knowledge that I do not have. So if we could have the whole board in some capacity available on that call, I think that would be very useful.
Okay,
This is
well,
Mike.
can you hear me?
Yep, we can hear you, Jody.
So you are not currently posted to join that meeting. If you want to join that meeting, then you need to post. Because this is an emergency situation, I believe in this case, you can post under the 48-hour requirement, but you should call it an emergency meeting.
Okay.
And in terms of how many we can have, I'm not sure. Mike, can you answer that question in terms of the total number that can participate in a virtual meeting?
So as it's currently set up, we have a total of 1,000 as our maximum attendee. However, that's including attendees as well as participants. I don't believe there's a limit on the number of participants. There does seem to be a limit of 6 concurrent video streams. We encountered that earlier.
What I would suggest is obviously the video, it can be adjusted somewhat, as I am blacked out right now, which is fine, but I'm sure we will have the selectmen showing, and then perhaps Zach as the Board of Health chair, and we can flip to Jeff as needed. But the rest of you, it sounds, can participate as long as you post. And certainly anyone can call in, as Elizabeth did to this meeting earlier. The general public can call in. There is a way to manage that. But if this full board or a quorum of this board wants to participate, then Jeff needs to get that posted as soon as possible.
Okay, I mean, I think that's probably the way we'd like to go. And the other thing I can offer, Mike, is if you want to do what we're doing today, which is that, like, maybe I could be in charge of muting and unmuting the board members, so that you could handle, say, the Board of Selectmen members, and I could handle the Board of Health members, or something like that, if that makes your job any easier. That way we don't take up too much screen space, and I could just maybe turn on, one of our members who wants to speak. If that's helpful, we could do that as well.
Yeah, I mean,
Mike,
yeah.
Can I also say, just for the public, I know you guys are getting into particulars, and maybe, you don't need to address it at the public meeting, but we will be updating the selectmen agenda shortly, with the phone numbers to call in and the instructions to participate. So you will be able to find that on the posted selectmen agenda a little later today.
Thank you. Yeah, so if you're thinking about wanting to attend, if you're the public right now and you would like to attend the selectmen meeting with Board of Health on tomorrow, the phone number will be posted on the selectmen's agenda.
Sounds good.
I'll have that posted as fast as I can have the clerk posted today. So next hour I'll post it.
Great. Yeah, because I think that's really important for us to be a part of that meeting, just so that we're all on the same page. It's really not about, control or power or anything like that. It's just about us all working together. Our town, I know, is great at doing that. We've done this many times before. There's been many, public emergencies, snow events, and so forth, where we all work together. We have a lot of experience doing that, and it always works great. So I just want to continue doing that, because normally in those events, at least we can, kind of get to the same building and work together. Here, it's a little bit more challenging because we're having to do it virtually. But as we're seeing from this meeting today, I think that we've been able to, communicate really well together. So I think it's working out really great. Thank you, Mike, for making this happen.
You're welcome. Can I just add one comment about organizing?
Sure.
And maybe this is not a public issue, but just the meeting belongs to the person who's chairing it. So I've let you drive this meeting largely, and I think we need to use a light hand if we're assisting whoever's chairing the meeting. The meeting should belong to the person who chairs it. Okay.
Yeah, no, that's really great. I think it's worked out really well. And I think this idea of kind of raising your hand works great, because from the chair's point of view, it's easy for me to see who needs to to speak and who'd like to be talking. So that worked out great today. I know it'll be a little more challenging on Tuesday just because there'll probably be less video streams, but there is a virtual hand raising button on there. So familiarize yourself with that, because I can kind of monitor that and call on people. So I think it worked great today. If you guys have any feedback, please let me know now. Otherwise, you feel free to text or email me, personally. But I really do appreciate you guys being here this morning, and Jeff, especially you and Gail and Ray and the whole Board of Health staff. Appreciate all the work that you guys are putting in, because I know that this is a lot of effort. So I really do appreciate it.
Thank you, but we're happy to do it. This is kind of what we prepare for and what we do.
Jeff, let me know if you need anything. I'm available.
Absolutely.
Thank you, guys. I appreciate being included in this meeting. I appreciate it.
Thank you, Gail, for all your hard
Thanks
work.
for all
Really,
you're doing, Gail.
really do appreciate it.
Thank you, really.
Moving forward, Zach, as far as for the foreseeable future, do you want to set a meeting time to we can do this virtually? Do you want to do 8:30? Is 8:30 in the morning on Mondays a good time to meet and kind of recoup and gather?
Yeah,
that works for me. How about you guys?
The only question I had was whether it makes sense to do it after we have our meeting with the state.
Oh, I see. So that Wednesday, is it the Wednesday meeting? Or no, Tuesday meeting at 3?
Tuesday, I believe. Yeah.
Yeah. If you that's not a bad idea, just because we would have kind of more of the latest information. So we'd be looking at maybe doing like a Tuesday. Let's see, that meeting's at 3 o'clock. I assume it's going to take at least an hour to go through, plus you need to digest it. So that would probably put us at least 5 or 6 p.m. on Tuesday, the 24th. How does those times work for everybody?
Fine for me. I have a very clear schedule right now.
Your schedule's been cleared, yeah. Jeff, is there a preferential time for you?
My preferential time is whatever yours is. I'm going to make anything work. This is number one.
So let's see, is making it say 5 o'clock on Tuesday, is that too close to the actual?
What time is
the meeting's at 3 o'clock, but I don't know how, do they normally go about an hour?
I think they tried to limit to an hour last week.
Yeah, 40 minutes to an hour is about what the meeting, the call usually goes.
And then does that give you enough time, if say we did it at 5 o'clock, to kind of process any new information that comes in? You want to move it later at all?
I'm good with 5 while it's fresh. I mean, at the very least,
we
discuss it. We process it and discuss what the state has to say. So I'm good with Tuesdays at 5.
Okay. So then, yeah, let's tentatively, or maybe not let's officially schedule it for Tuesday at 5, unless you hear something else that comes up, Jeff. Mike, I guess I would ask that if you could help us to make that happen, that would be great.
So, yeah, I can put them, schedule it. That's no problem. Okay.
And so I assume I'm just as a housekeeping thing. So I assume that means that we'll all be looking for an email from Mike that will give us the meeting, call-in details.
Right. Is same panelists as this meeting?
Yes.
Yes, with the Joanne Belanger, who works for the town of Andover, is the reason why she wasn't on the call. She's got her own directives that she has to follow for her town. Would like to be on those calls as well. So I want to make sure that she can do 5 o'clock as well. And
can you send me her contact information?
I certainly will.
Thank you.
Excellent. All right. Well, thank you everybody for virtually appearing today. This I think it worked out far better than I had hoped. And thank you, Mike, and all the IT staff for making it happen. Thank you to the Board of Selectmen for involving us, and we'll be joining you on Tuesday. And thank you to everyone who was in on the meeting virtually and called in. If you have any questions for the Board of Health, feel free to go to our website. We've got a ton of great information there. And Jeff is updating it all the time. So that's what you want, is you want the latest information. And we will be speaking all together again tomorrow. Thank you so much. I just guess we need a vote to adjourn. Those in favor of a vote to adjourn, I guess I'll do a roll call vote. Sue Hanley?
Yes.
Stephanie Granger?
Yes.
Zach Cataldo, yes. I think Michelle is not on the call, so I think that's all we needed for that vote. So we are adjourned.
Thanks, Sarah.
Thank you, everybody.
Thank you.
Thank you.
Stay safe.
And we're out.